Hi, my name is Catherine, and today I'm going to talk about a project I worked on this summer during my CUSRA internship under the supervision of Dr. Jean-Philippe Gouin and his graduate student Sarah Madovic. And the project is called Psychological Distress in Older Adults during the COVID-19 pandemic. So when the pandemic was declared, specific health measures were implemented, such as social distancing and face mask wearing. But there were specific measures that were targeted to individuals who were 70 years and older, such as stay-at-home orders. Now, these stay-at-home orders didn't come without consequence, and we believe that there was an increase in psychological distress in these individuals due to increased isolation and a general tendency to have more difficulty with newer technologies. So what is psychological distress? Psychological distress is a state, according to the American Psychological Association, is a state of emotional suffering characterized by symptoms of depression and anxiety. So what we know from studies conducted in the US, Canada, and England is that there was a peak amount of psychological distress during the initial phase of the pandemic, followed by a reduction a few months later. But what we don't know is what happens a year later on with regards to psychological distress. Other studies have also shown across the world that on average, older adults tended to be doing better than other age categories with regards to psychological distress during the pandemic. But this doesn't nuance what's actually happening in this older adult population. So the aim of this study is twofold: to identify the long-term evolution of psychological distress among different subgroups of older adults in Quebec across 4 time points from April 2020 to June 2021, and to understand the predictors of the different trajectories of psychological distress these individuals present. So participants were 645 to be a part of this study, and they were recruited from the Centre de recherche de l'Institut de gériatrie de Montréal and the Study sur la santé des aînés. All were over 60 years old and all spoke English or French. So data was collected across 4 time points: at the initial stage of confinement, after the first deconfinement, the second confinement, and after sustained confinement. And what our results showed was that in general, in this older adult group, psychological distress was stable across the first 3 time points. So first confinement, first deconfinement, and second confinement, but it increased in the 4th after sustained confinement. And when we look more specifically at subgroups that make up this overall trend, we can break up older adults into 3 main categories. So the biggest category is the resilient group, which shows relatively stable levels of distress that are not easily flustered by external events. The second largest group is the fluctuating group. This group was sensitive to external stress, as can be seen by the fluctuations in psychological distress across time points, and they were particularly vulnerable at the 4th time point, as can be seen by this large increase in psychological distress after sustained confinement. And finally, the smallest group was a group of older adults who were generally had relatively stable increase of psychological distress across the 3 time points and remained stable across the sustained confinement. And when we look at risk factors that explain, that predict what category individuals will belong to, we can see that poverty and the inability to use education increase the risk of being in the elevated group of psychological distress by 4 times. There are also clinical factors that also increase the risk of being in the fluctuating or the elevated group, such as chronic mental health problems, problems with mobility, insomnia, being lonely, and the list goes on. So The strengths of the study are that there are many time points taken that haven't been seen in previous studies. It uses a group-based trajectory modeling to really nuance what's going on in this large group of people. And we studied numerous predictors to see which were significantly contributing to psychological distress. Some limitations are that it's a convenient sample and that there are some overlapping time points in the data. I think future direction should probably look at long term, even more long term, of what's going on after this fourth time point in this population. And I think there are a lot of clinical implications to be taken away from these findings. Um, Specifically, I think to reduce psychological distress, individuals living in poverty and who have a hard time accessing technology need to be given more money, need to be given access to technology as well as accessibility to technology. So, classes on how to use technology. And there are also clinical factors that also need to be taken into account, such as mobility, increasing their ability to move around, increasing services to allow them to move around, as well as maybe creating virtual groups to decrease loneliness in this population. So thanks for listening to my presentation. I hope you thought the research I participated in was interesting. Thanks a lot.